Hey everyone, it's Diego Roy from Acupressure and Wellness, and I'm here today and I just wanted to talk about how to apply pressure in an acupressure treatment. And for some people it may seem like, oh, really easy, and maybe intuitive, and that's great. For others it may be like, yeah, how do you apply pressure in an acupressure treatment? Well, there are, I would say, literally millions of therapists worldwide who practice acupressure. And so there are different methods and techniques and styles. I'll share with you my approach, how I apply pressure in an acupressure treatment. And what I do is I use my thumbs. I don't use my fingers as much. So I use my thumbs. I use this part of my hand, this bony, hard bony part right here. And then I also use my elbow. And so you just use whatever's comfortable for you. And when you apply pressure in an acupressure treatment, what you want to do is when you say, if you're going to work, in a certain area, place your hands on that area, and immediately when you place your hands on that area, already you're emitting a frequency and you're emitting a vibration, and basically heat is coming off of your hands, right? You're radiating energy, radiating heat. So place your hands on that area and feel for tension and knots. And if you're familiar with, where knots tend to form, go after those first. You'll get great results if you go after working on the knots. Acupressure points have classical locations. They float around based on the individual person's anatomy and body. So I think a great starting point would be just to feel for knots and start hitting those knots. Sometimes the knots are in different locations where people are complaining of pain, but they radiate nerve sensation and pain to that spot that they're complaining about. So it can help you be effective if you kind of just begin by feeling the area that you're gonna massage, feel for the muscle tension, and start working on the muscle tension. So let's say, for example, using your thumb on a knot as you apply pressure. Keep in mind now, you want to really use that part of your body that you're applying pressure with as a sensor. So when you're applying pressure, you're almost like applying pressure and you're pulling back at the same time. So what I mean is, as you apply pressure, you're bringing your energy into that point. You're focusing on that point and you're trying to break up the hard tension in that area. But at the same time, you're sensing how that tissue is responding under your pressure. And it can be your elbow too. As you're applying pressure, your mind is right on the point where you're making contact, and you're feeling that tissue either resist your pressure or resist it, then release, or like just completely release under your pressure, or it just begins to resist you and fight you. So in a nutshell, if you're feeling it release, you're applying the right pressure, because it's a real give and take. It's a real give and take. You're applying the pressure, and so you're sensing how that tissue is responding to your pressure. And as it releases to your pressure, just like the layers of an onion, you can go a little deeper, and you're counting up from 12 to 15 seconds. And if like at the 15-second point, you feel it releasing, then what you then do is you just move slightly over and you press on that knot, trigger point, right? Slightly in a different location, and you start the 15-second count again. So you're releasing this really tight knot that's there because of repetitive strain or an injury. And you're like, it's almost like it's a lock, and you're finding that combination, the right combination to get that whole thing to just unravel. Yeah. And that's the approach I take mentally, you know, when I work on knots, right? And so the amount of pressure you use and the depth that you go into that point is based on the feedback and response from the muscle tissue that you're pressing. If it's resisting you and it's actually fighting you, then I spent the first 10 years fighting back, and it's not like, that's not how, you know, I'll tell you right now, just ease up and come in at a different angle. If you feel the tissue releasing under your pressure, then continue with that amount of pressure, and just, you know, it's like this real, how would I say, it's a give and take thing, and you know, as you feel it releasing, you keep pressing and playing with it and working around. Yeah, so you're working around in like a bigger and bigger circle, 12 to 15 seconds each time. Yeah, and so the depth again and the time, it is based on how that knot is responding to your pressure. I hope that helps, and I'll be back with some more videos and other techniques that, and also some of the massage tools and devices that I use that I would like you to become familiar with and be able to help yourself and help others. Thank you.